Hello beautiful people, welcome back to another video. If you're new here, my name is Lois Odor. So currently I've been looking into other jobs that we can get into as healthcare workers, that apart from working in the hospital, what are other things that we can do that can make us earn even more money than working in the hospital. And I find that some of these things we as Africans haven't really embraced them, and that is why I just wanted to talk about some of these ideas, and maybe you can start working on one, because I know there'll come a time whereby we'll really start taking healthcare seriously, and that is when most of this stuff will really start getting implemented. So if you're really interested in starting your own thing as a healthcare workers, make sure that you watch this video to the end and don't forget to subscribe. So the first one is starting a medical spa, and mostly what they do is doing the injections, the laser treatments, the massage, facials, body treatments and such kind of things. Although in some countries like the US, so many people have gotten into this business, but when you see someone has already started a business, that doesn't mean that you don't have a chance. When you come in with something new, something different, and you challenge like those competitors, you can be able to get into the market and still win most of their customers. So even if it is flooded in other countries, don't be scared if you want to start it. But then here in Kenya, like the medical spa stuff hasn't really been embraced. Like there's not so many medical spas. So if you're interested, you can just start learning about how it is done. And one thing that I like to mention is that it usually requires an expert, because there's some of the things that will really require someone who knows how to do it for them to do it. So before you think about opening it, make sure that you consider some of the things that are required, because it is something that is quite serious, a little bit serious. You just don't take it as a business because it's about someone's body. And then the other thing is that nowadays people really care about how they look. Not that supporting people changing how they look or something, but nowadays so many people are really obsessed with their bodies and how they look, and people are really obsessed with self-care and such kind of thing. That is why getting into such kind of a business can really get you to attract all these customers, especially ladies. So that is something you can kind of consider. And then next we have starting a medical courier business. This is whereby you do deliveries. You can deliver equipment to patients or to hospitals, but then you can also deliver specimens. Let's say you want to deliver even organs. Let's say someone has donated an organ from a certain hospital that it has to be taken to the other hospital, so you are contacted and then you do that. Even you can deliver, let's say someone is from home and maybe they want to donate a blood, they don't really have to go to the hospital, so you can do such kind of things, if you're getting me. But then remember, this requires you to have a certain equipment that will be able to like store these organs properly. You need speed, because at times it's even an emergency. Maybe for that donor it's even an emergency and you really need to have speed. You really need to be like, it's good if you have specialization, if maybe you are specifically on equipments or you are specifically on specimens and on a certain kind of specimen, so that you just don't mix up all your work or something. And then the other thing is you have to assure your customers that there's security, that what is happening in between you, like removing the organ from one person to another, like it is something that is being done the correct way, because there's usually so many stories about people exchanging organs, you not being able to like deliver. You really need to be specific, have security, show that they can trust you, have the right equipments. Yeah. And then when you want to specify on the equipments, you can just take like the equipment business by itself. So you can just be selling equipments. You sell medical and you sell even surgical equipments. But then if you really don't want to have the bulk of finding equipments from another country and having to ship them and sell and what, you can do rentals. Like you can be renting equipment. You find that there are people who are being treated from home, but then they have to buy a certain equipment, and then later on they won't have to use it anymore because maybe they, like, you get me. So you can do rentals whereby, let's say they need oxygen tank, or they need a certain equipment depending on the disease that it's going on there. So you can rent this equipment, then they use it for the period of time that they are going through what they're going through, then later on they'll have to return it back. So remember, people will prefer this from buying an equipment, especially if they don't have to use it anymore, because for this it will end up being cheaper. Like you, and even like imagine you've already bought so many equipments and you're like, the person who was sick is now okay, and now you have to find a place to like take them. So remember, if you just have to rent them out, it's also convenient for people because they won't have to keep all this equipment for like in their houses. So you can do selling, wholesaling to hospitals, but then you can also do like renting this equipment. Then the other thing is psychotherapy. Like you can use therapy in form of talking to people to be able to help them like in change of behavior. I know this is something that hasn't really been embraced because most people usually think, oh, I really don't have to talk to someone for me to be able to like change the way I do things, for me to be able to feel better. Like it hasn't really been embraced, especially in most African countries, but I'm so sure there'll come a time whereby people are really, I don't want to say educated, that people are not educated right now, but if you're getting me, like whereby people really embrace such kind of thing, that it's okay to talk to someone even if it's a stranger, so that they can help you go through something. So you can get into the psychotherapy business or any other kind of therapy business, and at times it is not even a must for you to do it like person to person. Yes, you can do it from person to person, but nowadays people even do it through the phone, through emails, and then like anytime you have a session with someone, you get paid. Next we have palliative care. So you find that people with these complex illnesses, at times they need care, a certain kind of care, but you manage the symptoms and you help in relieving pain. So you can just specify in palliative care, that is when you're doing the home care stuff, and then you can help this kind of people so that at least you can reduce the congestion in the hospitals. Like I usually not like the fact that we are like the hospitals are so congested. Like you have 40 patients whereby 20 of them are people who can just stay at home or stay in a certain center whereby they can be taken care of from that center. Yeah, so you can get a job from there, so that your job is just to deal with those kind of patients, help them in relieving the symptoms, help them in pain management, and that is just it. Like this is also a way of increasing more job opportunities for healthcare. Next we have addiction treatment centers. So this is whereby you deal with people with mental illnesses and also people with who are going through substance abuse, like starting a rehab center. Like I know it is not so flooded, like not so many people have these kind of personal centers, especially rehabs. So you can just look at your own area where you live and then just look at how many centers are in that area, how many people are getting into mental illnesses, how many people going through substance abuse and they really want to overcome that, how many people are going through addiction. Like nowadays there's so many kinds of addiction, even internet addiction, sex addiction, gambling. It's only that we Africans don't really want to accept the fact that we are going through a certain problem, we are going through addiction, and we need help from someone to help us go through that, or to help us, like, you getting me? Yeah. So if you can start such kind of a center, you know, most of the time people won't embrace it from the first, but then if you help someone go through the process, maybe until like the drug is cleared from their system and they're able to go back to normal, and then their life starts being successful, they'll refer someone else to you, someone else will see this and refer someone else, and this is how you grow such kind of centers. Because if you start looking at it in such a way that, oh, no one goes to like rehabilitation, no one asks for help whenever they're going through addiction, then you can never open such kind of a thing. So if you're interested, especially the KRN, MHP, the nurses who did mental health, yeah, that this is a really nice idea for you. If you wanted to open a private practice, you can open such kind of centers, addiction centers, rehab, and such kind of a thing. And also you need a profession. So a profession, because you cannot just open and live like that, like anyone can run it. You open it and you have professionals working there so that it becomes effective, so that you just don't open it for the sake of finding a job, but make sure that people feel the fact that, you know, most of the time people open so many businesses for the sake of trying to get customers, but then you won't get them if they don't see the professionalism in you. Like I usually see where we live, so many people are opening the chemists, but you find that people usually go to this one person whom everyone knows he is a real doctor, like he has gone to medical school to study what he's doing, and whenever you go to him, he explains everything so well, and the drug that he gives you, most of the time you'll feel better. So everyone runs there, that you'll find a really long queue there, and then the other places people are not going. So make sure you find professionals and you make it look so professional so that they can even recommend more customers to you. And then when you go back to the stuff of home care providers, you can start your own private duty nursing. Let's say you are just tired of working for the government and working for other people, you can start your own private duty nursing, whereby you take care of people from home, or you do like mobile telehealth and such kind of things. So you can just start your own private duty nursing, either as a group or as an individual, like whichever is best for you. You can always get into starting your own private duty nursing. And then you can also be a health coach. You can do the private or groups. Like at times you can be doing private, you talk to person, like person to person, but then you can do groups like schools, churches, whenever some people have a certain function and they need someone to talk about a certain disease. Now this is where you come in. And also nowadays there are so many of the lifestyle diseases coming up, diabetes, heart diseases, and also so many people are being obese nowadays. It's so increasing. So you can do like health coaching. You can also visit someone from their home. Let's say they've been diagnosed with a new condition and they don't understand it. You can like do the explanation or something. Like there's so many, when it comes to being a health coach, there's so many ways you can maneuver. You can start your own blog, you can do videos. There's so many ways, because nowadays people are trying to search like about high blood pressure, about diabetes, because these things are coming up and they really want to know it from an expert. So yeah. And then you can also start selling products. You become an entrepreneur, so you can sell products directly, whereby you have your own product. Let's say you have a scrub line and then you sell the scrubs directly, or you can do affiliate marketing, whereby there's someone else who is selling these products, but then you refer customers to this person, and then there's a certain amount of fee that you're being paid for referring those patients, not patients, those customers. So apart from those that I've mentioned, I'd like to add some additional ones, tips, some additional ones. So we have starting a nursing home, starting a DNA testing center, having a private ambulance. Like you can just imagine, maybe in that area that you're living in, you have a private ambulance that whenever if someone gets sick at night or something happens, they can call you and you'll be the one who will be like taking them to the nearest hospital. So it's a private ambulance, aesthetic business, a fertility clinic, kidney dialysis center. Like we as medics, there's so many things we can get into. It's only that we haven't really learned about most of this stuff, and that is why like at times we usually just hear, oh, we don't have jobs. It's because all of us are trying to get into working in the hospital. We are already flooded and everyone is trying to work in the hospital, and that is why there are no jobs. It's not that we don't have chances to work as medics. It's only that we haven't thought of other things that we can do apart from being bedside nurses or doctors who are working in the hospital. Like there's so many other private things that we can do, things that you can enjoy. Like I usually don't understand why you work somewhere for almost 10-15 years, you're still saying you don't like that job and you're still there. Why don't you just save enough money, look at some of these ideas, look at something you can get into that is related with your career? Because right now I know you already know so many hospitals, you already know so many like medical people who work in the healthcare, so you can just have connections to all these like hospitals and work and people, healthcare workers. So if you're selling products, you know whom to sell to, you already have customers. If you're doing, let's say, even the delivery stuff, maybe for the specimen, like it's something that you can do because you've already worked there for a certain amount of time. So I know when people usually complain that they don't like their jobs, then there's something that you like. Just try and realize what is it that you like and how can you connect it with the job you are in. Yeah, so if it's healthcare, these are some of the things that you can get into. I did a video about a side hustle, so you can start doing it as a side hustle. Then later on, when you've gained enough capital and you've become like more stable, you can just dwell into it. And like I'm telling you, when you do something you love, you're just going to live the best life you've ever imagined. So thank you for watching this video and see you on my next video. Bye bye.